Welcome back. In this video, we'll focus on practical case-based projects where you'll have the opportunity to create personalized care plans for various real-world scenarios. These exercises are designed to help you apply everything you've learned so far about depression care, from diagnosis to treatment planning, and ensure that you can develop effective, individualized plans for patients with different needs. Let's begin with our first scenario. Scenario 1. Managing a patient with recurrent depression. Imagine you're working with John, a 42-year-old man who has had multiple episodes of depression over the past 10 years. He's currently experiencing a moderate depressive episode, with symptoms including low mood, fatigue, poor concentration, and sleep disturbances. John has responded well to antidepressants in the past, but he's struggling with medication adherence due to side effects like sexual dysfunction and weight gain. Your task is to create a personalized care plan for John, addressing the following. Medication management. You'll need to select an appropriate antidepressant that minimizes side effects. If John has had success with SSRIs in the past, you might consider continuing with an SSRI but at a lower dose, or switching to a different SSRI that may cause fewer side effects. You could also consider adjunctive therapies like bupropion, which has a different side effect profile and may help with both mood and sexual side effects. Therapy. Cognitive behavioral therapy, CBT, should be integrated into his treatment plan. CBT is effective for managing depressive thoughts and behaviors and can help John improve his coping skills and reduce rumination. If John has difficulty committing to regular therapy sessions, you might suggest online CBT programs or group therapy, which can provide flexibility. Lifestyle adjustments. Encourage John to incorporate exercise into his routine, as physical activity is shown to have antidepressant effects. Regular sleep hygiene and stress management techniques like mindfulness or relaxation exercises could also be valuable components of his plan. Additionally, social support is essential. Encouraging John to reconnect with family and friends or to engage in community activities can help reduce feelings of isolation. Reflection questions. How can you tailor the medication regimen to address John's specific concerns, such as side effects? Why is CBT a good option for treating John's depression? And how can it be integrated for treating John's depression? Scenario 2. Managing a patient with treatment-resistant depression. Now let's consider Sarah, a 30-year-old woman who has been living with severe depression for several years. She has tried multiple antidepressants and undergone CBT, but her symptoms persist. She's experiencing extreme hopelessness, low energy, and is having difficulty functioning at work and in her personal life. Your task is to create a personalized care plan for Sarah that includes strategies for managing her treatment-resistant depression. Reassess the diagnosis. Since Sarah has not responded to multiple treatments, start by reassessing the diagnosis. Is there an underlying comorbidity, like bipolar disorder or generalized anxiety disorder, that could be influencing her symptoms? Consider whether Sarah's medications may need to be adjusted or switched to a different class, such as SNRIs, MAOIs, or tricyclic antidepressants, TCAs. Advanced treatment options. Electroconvulsive therapy, ECT. If Sarah's depression is severe and resistant to treatment, you might consider ECT, which has been shown to provide rapid relief in patients with severe, treatment-resistant depression. Transcranial magnetic stimulation, TMS. TMS is a non-invasive option that could be effective for Sarah. It uses magnetic fields to stimulate the brain and is an alternative to ECT when appropriate. Ketamine or esketamine. These emerging treatments can be used for patients with depression that hasn't responded to other treatments. Psychosocial support. Sarah will benefit from ongoing psychotherapy to help her manage stress and emotional distress. It might be helpful to explore different types of therapy, such as interpersonal therapy, IPT, which focuses on improving relationships and reducing emotional distress related to interpersonal issues. Encouraging group therapy or a support group for individuals with treatment-resistant depression can help Sarah connect with others who understand her struggles. Reflection questions. How can ECT, TMS, or ketamine help a patient with treatment-resistant depression? What steps would you take to reassess the diagnosis in Sarah's case to ensure the treatment plan is accurate? Scenario 3. Managing depression in a patient with comorbid anxiety. Now let's look at Tom, a 25-year-old man who has severe depression and generalized anxiety disorder, GAD. His depression symptoms include persistent sadness, fatigue, and hopelessness, while his anxiety manifests as constant worry, restlessness, and difficulty concentrating. Tom has been prescribed SSRIs, but still struggles with daily functioning. Your task is to create a personalized care plan for Tom that addresses both his depression and anxiety. Medication management. Given Tom's comorbid anxiety, you may want to prescribe an SSRI like sertraline, which can help with both depression and anxiety. However, if Tom does not respond to SSRIs, consider switching to an SNRI, which is often effective for treating both conditions. If his symptoms are more severe, consider benzodiazepines for short-term use or an antipsychotic in addition to an antidepressant, but always monitor for side effects. Psychotherapy, cognitive behavioral therapy, CBT, is an excellent choice for treating both depression and anxiety. CBT can help Tom identify negative thought patterns and develop healthier ways of coping with his worries and sadness. Consider mindfulness-based interventions or relaxation techniques, which can help Tom manage his anxiety and increase his sense of well-being. Lifestyle adjustments. Encouraging Tom to engage in regular exercise, practice mindfulness, and adopt healthy sleep habits can significantly improve both his depression and anxiety. Social support is also essential. Ensure that Tom has a reliable network of friends or family to turn to when he's feeling overwhelmed. Reflection questions. How can medication be adjusted to treat both depression and anxiety in patients like Tom? Why is CBT effective for patients with comorbid depression and anxiety? Embedded knowledge quiz. Now, let's test your knowledge with an embedded quiz based on the case-based scenarios we discussed. Question 1. What is the most appropriate treatment for a patient with recurrent depression who is experiencing side effects from SSRIs? A. Switch to a different SSRI. B. Try an SNRI or consider adding bupropion C. Discontinue medication. D. Switch to a tricyclic antidepressant, TCA. Answer B. Try an SNRI or consider adding bupropion. Question 2. Which treatment option is typically used for treatment-resistant depression? A. Electroconvulsive therapy, ECT. B. Increased dosage of SSRIs. C. Psychodynamic therapy. D. Switch to a new therapist. Answer. A. Electroconvulsive therapy, ECT. Question 3. What is the first step in managing a patient with depression and comorbid anxiety? A. Prescribe a mood stabilizer. B. Increase the dose of antidepressants. C. Prescribe SSRIs or SNRIs. D. Focus solely on treating anxiety. Answer. C. Prescribe SSRIs or SNRIs. Clinical vignette 1. A patient with treatment-resistant depression has not responded to SSRIs. What is the next appropriate step? A. Increase the dose of the SSRI. B. Switch medications or consider advanced treatment options like TMS. C. Discontinue medication and offer therapy alone. D. Continue with the current treatment for a few more months. Answer. B. Switch medications or consider advanced treatment options like TMS.